From my perspective, the way that Gloucestershire is leading the way is that it has an established ACP group within multiple specialties around the hospital, whether that be trauma and orthopaedics, ENT, neonatal care, and now in general surgery. The biggest change is I don't have to repeat things that the ACPs have already done. If they've made a call, I believe it and I go in with a plan. The ACPs have been absolutely critical in improving our emergency general surgical service. The most important thing is that they have been important for patients. They care and they're good at what they do. They've all come from senior nursing backgrounds. They understand how wards work. They understand how consultants work. And that's been fabulous to watch, and I'm really excited about the future.
My name is Jay Smallshaw and I'm a trainee ACP within the emergency surgical department. So at the moment there's 3 trainee ACPs all working together within emergency surgery, and predominantly our role is the clerking and initial assessment of patients that have presented with a surgical complaint, and also supporting the ward nurses with the emergency surgical take and the doctors, mainly the registrars that come in, to be able to give them some support and a sound knowledge base, I suppose, for the junior doctors, the F1s that are just starting out in their career. Every day is different. Our surgical assessment unit is really busy. We predominantly spend a lot of our time within there and this, the day-to-day running of the ambulatory service. I've always really enjoyed emergency surgery. I've always really enjoyed surgery. I feel like it's definitely the part of my job that's kind of really ignited a passion in me. And it's just nice to be able to carry on doing the job that I love, but be able to progress and advance throughout my career whilst doing, the part of the job that I really enjoy.
My name is Juby John. I work as an advanced nurse practitioner in emergency general surgery. I've been a nurse for the past 23 years, so thinking of my career progression, so I thought I have to do something challenging and more interesting. We are the first port of call, so they come to us and we assist them, see them, clerk them first, and if we worry at all, we do need a doctor, then we contact them. So I think the surgical assessment unit figures, the patient flow figures are much better when we started.
My name is Danielle Stevens. I'm an advanced clinical practitioner at Gloucester Royal. I like to study, so being a surgical nurse, I then wanted to progress and just being able to make further decisions when patients are unwell. The training's really good, the support's really good from not only the consultants but all of the junior doctors and the nursing staff as well.
Recently we had a patient who was unwell with an infection in their groin.
When I saw him, he was shivering, didn't look well, but was still talking and communicating well. And then when I looked at the abscess, I was really concerned because it was something, as I'd seen previously, which was necrotizing fasciitis.
Because of the strains on the hospital, the registrar was elsewhere, the consultant was elsewhere, but the ACP knew to escalate quickly and came down to theatre to find the registrar.
In that meantime, we got the patient IV antibiotics, regular observation, ECGs, repeat blood tests and pain relief. So we were giving him everything we could at that point and just reassuring him that he was in safe hands and that everything was going to be okay.
Because they've been working for us for 18 months, we trust them. We understand that they know what they're doing, they know how to assess patients, they know how to initiate management plans.
The patient was transferred straight to theatre. I then ran downstairs to theatre to see the patient, continue giving the IV antibiotics to ring his next of kin.
So that patient was recognised as severely ill very quickly and taken to theatre within an hour and undoubtedly had life-saving surgery.
He's done really well and he's recovering well now as well.
That really showcases where we can make a difference. One surgical registrar is operating at the same time as my colleague is reviewing critically unwell surgical patients, and I think that really just shows how we can make a difference in our department.
You need ACPs, it just helps the team. Where there's a lack of doctors and nursing staff, it helps to bridge the communication between the teams.
So if anyone want to learn new things and good in education, they want to progress in career with the university works, I would suggest the best thing is the ACP pathway.
On a professional level, we've just grown to trust them hugely, and we know how effective they've been in our SAU particularly. They're a really tight unit, and when they're not here, like when they're on their master's programme, we really notice it. Tends to be a bit more of a backlog in SAU, decisions aren't made, my job becomes much more difficult, so we welcome them back whenever they've come back from their masters, because everything runs more efficiently.